Our health is very important to us, and we often refer to life expectancies to get a glimpse of what our future entails. However, life expectancies can be misleading as our health is more than just mortalities. This is where disability adjusted life years, commonly referred to as DALYs, come in. What are DALYs? One DALY is the loss of 1 year of full health, free of disability. More specifically, it is the years of living with a disability or lack of full health plus the years of life lost due to premature mortality. To better understand this, it is important to realize that there are different types of burdens of disease. There are cases where individuals may face death but have no disability. Examples of these cases include self-harm, measles, or death by accident. There are also cases where individuals acquire a disability but do not face direct death. Examples of these cases include Parkinson's disease, pedestrian injuries, and dementia. In both these cases, individuals are deprived of their full health, except that cases of disability without death may be overlooked. Luckily, DALYs account for both types of cases. Here's a walkthrough of how DALY would be calculated. First, we calculate the years of life lost to premature mortality, the YLLs. To do this, you take the number of deaths due to a certain disease or cause and multiply by the standard life expectancy of that group. Then, we calculate the years lost to disability, the YLDs. Here you take the number of cases of a certain disability and multiply it by the disability weight, and then multiply by the average time a typical person lives with the disease during his life before death or remission. The disability weight is a standardized value that reflects the severity of the particular health state. Taking the YLLs and adding it to the YLDs gives us our DALYs. According to studies, in 2019, the global DALYs per 100,000 population was around 12,407 in South Asia, 1,597 in the United States, and 55,424 in Africa. These statistics highlight the uneven distribution of DALYs based on geographic region. There are also significant sex differences in DALYs, as women have higher DALYs than men. In 2017, age-standardized DALYs in thousands for females was estimated to be 29,934, where it was estimated to be around 35,834 in males. These differences may be attributed to increased participation in risk-taking activities and harmful lifestyle habits such as alcohol consumption, smoking, and indulgent eating in men. There are 4 main health behaviors, although there are also many other factors that fall outside of this list. Number 1 is smoking, 2 is physical activity, 3 is diet, and 4 is BMI. When comparing individuals with sufficient levels of all 4 health behaviors to those that do not sufficiently meet any of them, there are many important trends that can be identified. Individuals with a BMI greater than 25 who are considered overweight or obese are at risk of increasing their disability-adjusted life years. By maintaining their BMI below 25, individuals are estimated to have 1.04 lower DALYs. In terms of waist circumference, males with a circumference less than 95 centimeters or females with a circumference less than 80 centimeters are expected to have 2.07 less DALYs than those that exceeded those limits. A higher BMI and increased body fat are associated with the risk of chronic disease and lead to higher blood pressure, diabetes, cancer, and heart disease, all of which can increase your DALYs. In terms of nutrition and diet, alcohol consumption is another lifestyle factor that can be modified to show significant improvements in DALYs, as studies show that avoiding it can lead to a decrease of around 2.25 DALYs. A cholesterol to high-density lipoprotein ratio greater than 5 also imposes risks for DALY. Individuals can have 3.72 lower DALYs by monitoring and maintaining healthy levels. This is because cholesterol can increase the risk of heart disease by developing fatty deposits in blood vessels that make it hard for blood to pass through and supply the body, which also causes the heart to operate inefficiently and wear down. There are 2 types of cholesterol: low-density lipoprotein LDL and high-density lipoprotein HDL. LDL is a bad kind of cholesterol which should be reduced by minimizing the consumption of trans fats found in certain cooking oils, margarine, and processed foods. Individuals should aim to consume HDL through oatmeal, fish, almonds, and avocados instead to decrease their cholesterol to HDL ratio. Individuals on a Mediterranean diet were also estimated to have 2.13 fewer DALYs, since it contains a lot of fish, nuts, fruits, and vegetables that improve blood vessel function and lower the risk of chronic disease that could contribute to lower DALYs. Smoking tobacco is a major contributor to disease burden and is a leading modifiable factor that contributes to DALYs. By avoiding smoking, individuals are able to prevent chronic diseases such as lung cancer that increase years lived with a disability and also avoid premature mortality, leading to fewer DALYs. Finally, it is important to note that 386 million life years and 96 million DALYs were saved from the prevention of serious infections through vaccinations. Infectious diseases are a major contributor to DALYs as they can have fatal or long-lasting effects. According to the CDC, as vaccine availability and accessibility increases, there is a decrease in the incidence of infectious diseases. This indicates the urgency for interventions to enhance the provision of vaccinations in low and middle-income countries where there is insufficient accessibility. Recommendations include improving disease surveillance, increasing global health leadership, advocating for improvement in healthcare infrastructure, and gathering research and data on disease burden. There also needs to be increased dedication to health education to help individuals prevent modifiable risk factors for chronic diseases. Global leaders and local institutions can work together to target the root cause of disease and sustainably lower the DALYs throughout the world.